Hi, everyone. I'm Aaron Groff with the County of Santa Clara Public Health Department. Thank you for joining us here today, both in person and online via the live stream. Today, we are talking about public health response to a public exposure of measles. We're going to start things off with Dr. Monica Roy, our communicable disease and assistant health officer here at Public Health, will also be available to take questions. And then Patricia Serrato, our immunization program manager, will be delivering remarks in Spanish and answering questions in Spanish as well. So with that, Dr. Roy.
Good afternoon. My name is Monica Roy, Monikaroy. I am an assistant health officer for the County of Santa Clara Public Health Department. I'm here today to share information regarding a notification we received here yesterday of an individual who lives out of state but traveled here to our county and was later diagnosed with measles. We are working with the CDC, with the state health department and other agencies to investigate and identify any individuals here in our county who may have been exposed and provide them with recommendations on how they can stay safe and get any needed care that they need. Specifically in our press release, we are alerting individuals who've been at one of 3 locations on either July 1st or July 2nd at specific times that they may have been exposed to measles. And the main things that they should be doing is 1, checking their immunization status, making sure that they have a vaccine against measles. 2nd, if they are pregnant, an infant, or immunocompromised, or if they aren't vaccinated, that they contact their healthcare provider immediately. And the last is that they monitor for symptoms of measles, and those include things like fever, cough, rash, red eyes, and notify their healthcare provider immediately if they develop any of those symptoms. The good news is that people who have the measles vaccine are very well protected. The vaccine for measles is extremely effective. So for all members of the public, if you are not vaccinated, we definitely recommend that everyone get vaccinated and make sure that they have received 2 doses. With that, I'd like to pause and take any questions you might have. Yes, I will refer you the details in the press release. The first is a Starbucks location. The second is a restaurant that is located in Santa Cruz, and our colleagues in Santa Cruz are leading the exposure and notifications in their county. And the third is the San Jose Airport on July 2nd in the morning. Yes. Absolutely. Yes. So we are working with CDC in coordination with other states. We are actively contacting all Santa Clara County residents that were on that flight and providing them with guidance and recommendations. So you can see in the press release the flight number that would indicate where the flight was going. Uh-huh. Mhm. Yeah, so measles is one of the most infectious or contagious viruses or bacteria that we know of. Upwards of more than 8 out of 10 individuals who are not vaccinated but spend time near an infected case can get infected. So that's a really high ratio compared to other infectious diseases. One of the challenges is that measles stays in the air. So even after a person with measles leaves a room or an area, the measles virus can stay in the air for up to an hour or more after that person has left, and they can still continue to infect the person even though they're not even there. Shared airspace, yes. Mhm. We are less concerned about surface or fomite transmission. We're more concerned about transmission through the air and through respiratory means. Mhm. So we are following up with all the locations and individuals that the person was around while they were infectious. The 3 locations that we are sharing are here in the press release because these are places where we cannot identify individuals, and therefore we want to make sure that that the public at large is aware, so that they know if they were at that location, they can take the appropriate actions. But for everywhere else and all other individuals, we are working closely to identify all of those people. I unfortunately, to protect the privacy of this individual, we cannot share additional medical information. Yeah. Absolutely. I will say that globally and in the US, and even in the state, we are seeing an increase in measles cases. This is quite concerning. There have been outbreaks in several other states in the past year. We are, because measles is so infectious, we take and act very aggressively for every single case, any exposures, and that's why we're here today. But I think that's why it's so important for everyone to make sure that they're immunized, and particularly during the summertime, before you get on the plane, you're traveling, take your vaccine record with you. You can get it online. You can talk to your healthcare provider. Make sure that you know your vaccine status and you can show proof of it, especially because you're going to be at increased risk with all the travel that's happening over the summer. So there are a lot of reasons to consider wearing a mask, not just measles. As you all know, right now there is a increase in COVID activity that we've seen every summer. Our guidance is really it depends on individual risk for people. So people who are immunocompromised might have a different threshold for wearing a mask. When we see higher levels of COVID, that may be another indication when you're in an indoor crowded area. There's not a specific recommendation for measles at this time to be wearing a mask. Mhm. We're over 90 people. Mhm, mhm, mhm. Yep. Yes, aggressive action is needed for several reasons. We are still, for the most part, seeing cases primarily imported, so to speak, from international travelers. And what happens is measles tends to spread particularly well when you have populations that are unvaccinated. And the reason that it requires such an aggressive response is for 2 reasons. One is it can be very severe. Hospitalization, multiple complications, and death in some situations. And then the second reason is because it's very infectious. So it doesn't take much to quickly spread. And so that's why we need to be really on top of it, really aggressive in terms of containing the disease. Yep. Yes. Yeah. Absolutely. And that is what our immunization program and my colleague Patty Serrato, who's going to be joining, can comment further on. But we work closely and support programs like the Vaccines for Children's program, which does provide no cost vaccine to ensure that every child has access to vaccine. We have information and resources on our immunization website for where people can go if they don't have a healthcare provider and they are trying to get vaccinated. Mhm. Yes, there is, your risk is much lower if you're vaccinated, but you are correct that even individuals who are vaccinated could still get measles. And for that reason, one of our recommendations and that we've indicated in this press release is that that all individuals monitor for symptoms from day 7 to day 21 after they've been exposed. After day 21, if they have no symptoms, they can, feel assured that they're not going to develop measles, but they should be monitoring during that period. That we would need to defer to our colleagues at the CDC because this is an out-of-state individual. This is not a resident in our county. We would have to refer you there to any additional information about the case. Yeah. Mhm. Yeah. Yes, because this person lives out of state, this is requiring coordination between multiple states. And when multiple states are involved, the Center for Disease Control gets involved to help make sure that all necessary pieces are being addressed. Also, because the individual flew on a plane, that is another reason that the CDC gets involved. Mhm. Um, Yeah, so there were 3 exposures that we've listed on July 1st and July 2nd. The first exposure was at a Starbucks. The second one was at a restaurant in Santa Cruz, and on July 2nd, the exposure was at the San Jose airport, and that was on July 2nd in the morning. I'd have to refer you to Aaron in just a moment to give you the exact address, the exact times, but those again are in the press release. Uh-huh. Oh, thank you. Sorry. Sure. Oh, this. Oh. So Aaron was just, I think one of you were asking specifically about how much protection was available with the vaccine, and if someone's vaccinated, how much risk are they still at? So 2 doses of MMR vaccine is 97% effective. 1 dose is about 93% effective. So quite effective, does dramatically decrease your risk, but you still can, and we have had reported cases in the US of measles amongst people who are vaccinated.
There's a question about times.
Yeah. Here. Thank you. I'll read them off. I know you've been wanting that. Okay. So the first exposure is the Starbucks on 624 Blossom Hill Road in Los Gatos. And individuals who are there from Monday, July 1st, from 9:30 a.m. to 11:30 a.m. Are considered to maybe have been exposed. The second is Taqueria Los Pericos. That is on 139 Water Street. That is in Santa Cruz, California. If they were individuals who are there on Monday, July 1st from 6 p.m. to 10 p.m. May have been exposed. And lastly, on Tuesday, July 2nd, from 5:15 in the morning to 7:30 in the morning, individuals who are at San Jose Mineta International Airport, Terminal B, may have been exposed. Excuse me? Yeah. Right. That further information about the case we can't really share, and is really not per se going to change or affect our public health interventions. Mhm.
I'd say on that note,
Yep.
we can now turn it over to Patricia
Yes.
Serrato. Yeah, Dr. Roy, thank you. We're going to turn it now over to Patricia Serrato, our immunization program manager, for some remarks in Spanish and to answer any questions you may have in Spanish as well. So thank you all very much.
Buenas tardes, mi nombre es Patricia Serrato y soy la manejadora o la manager del programa de inmunización. Estamos aquí para comunicarle a todos que hemos recibido un caso confirmado de sarampión que llegó aquí estamos aquí para comunicar que hemos recibido un caso de sarampión confirmado en el condado. Esta persona vino y se fue del condado pero lo importante es que cuando estuvo en un periodo donde esta persona pudo transferir o infectar a otras personas. Esto es importante porque el sarampión es una enfermedad que es altamente contagiosa. Esto significa que una persona que está infectada puede contagiar esta enfermedad a otra y usualmente esto ocurre a nivel aérea, significa que cuando una persona está contagiada y habla o está tosiendo o estornudando, puede transmitir el virus a la otra persona. Es importante que todo esto se sepa porque esta persona circuló en el condado y hay unos lugares donde hubo una exposición probablemente. Hay 3 lugares que queremos principalmente remarcar. El primer lugar es, esto ocurrió en el julio 1 en Starbucks. Esto es en Starbucks en Los Gatos, de las 9 de la mañana a las 10 de la mañana. Esto está ubicado en 624 Blossom Hill Road. El segundo lugar que queremos mencionar es el lunes, julio 1, y esto fue en la taquería Los Pericos. Esto ocurrió de las 6 a las 10 de la noche y esto fue ubicado en 139 Water Street. Esto está ubicado en Santa Cruz. Y el tercer lugar, esto fue el julio 2 en el Aeropuerto Internacional de San José Mineta de las 5:30 a las 8:30 de la mañana. Ah, es importante que si alguna persona estuvo circulando en este lugar, en esta área, que reconozca o monitoree si tiene algún síntoma de sarampión. Los síntomas de sarampión que estamos hablando son como fiebre de 103 a 105, puede ser como un poco de rinitis o un poco de mucosera, como le llamamos. También puede ser a veces ojos rojos o relacionados con conjuntivitis. Es importante que monitoreen esto. Esto principalmente para las personas que son inmunosuprimidas, si tienen algún problema de su cuerpo o alguna enfermedad que está relacionada con inmunosupresión o personas que no están vacunadas. Esta es la información que traíamos y otra vez hay muchas formas como se puede prevenir esta enfermedad y principalmente es a través de la vacunación. La vacuna es la que llamamos la MMR. Esta vacuna protege contra el sarampión, las paperas y la rubiola. Y otra vez, si ustedes creen que han estado expuestos, es importante que llamen a su doctor, que monitorean los síntomas que mencionamos y que revisen sus récords de inmunización para saber si tienen la vacuna de la MMR. Gracias. ¿Hay alguna pregunta? No, that's good. Si una persona no está asegurada, if somebody doesn't have any health insurance, there are different programs. Right now, Medical is one of the programs that they can go. They can use. Now everybody can use Medical. So all the clinics or community health clinics, they can provide the vaccine through the state programs. So there are some state programs that provide vaccines to people who are underinsured or with no insurance. Yes, there are 2 shots. The MMR is one is at 1 year. No, it's just 1 year or 12 months, no less. And the other one is usually before going to kindergarten or before going to first grade. But the second dose can be also applied or administered after 4 weeks from the first dose. If it is unvaccinated, this vaccine has been around since 1968. Very likely that most of the people had the vaccine. If it happens that they don't have it, or they don't have records and are interested in getting it, they can go with the doctor. It's one dose. Mhm. You're welcome. Yeah. My name, Patricia, Patricia. And my last name, Cerrato, Cerra, as a apple, T as a tomato, O. Program manager for the immunization program. Program manager of the immunization program.
No more questions. Thank you very much. And thank you all for those joining us online as well.